Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through our primary care services, concierge services, telemedicine services, COVID-19 testing, as well as COVID-19 vaccines. Good afternoon, everyone, and welcome to Let's Chat. Today's topic is colon cancer. As many of you will know, yesterday marked a year has passed since real-life superhero Chadwick Boseman passed as a result of colon cancer. So in that vein, we are again trying to bring awareness to this very much needed topic. And so let's talk about one of the reasons why we need to bring awareness to this topic. The first is that in 2020 alone, 12% of all colorectal cases, so that's 12% of all the colorectal cancer or colon cancer cases in the United States happened in individuals that were less than 50 years old. So a lot of times, and in the past, people have thought, oh, colon cancer is something that only happens to people that get older. We are seeing that this is a disease that affects young individuals as well, and that unfortunately disproportionately affects African Americans. African Americans have the highest rate of colon cancer than any other ethnic group in the country. African Americans are 20% more likely to get colon cancer than other ethnic groups. In addition to that, African Americans are 40% more likely to die as a result of colon cancer than other ethnic groups. So that's one of the reasons why we're talking about it today, just trying to bring awareness, and especially trying to bring awareness to it because the way that we diagnose it is through a screening test. And in the current climate that we're in right now in the pandemic, this is one of the screening tests that sometimes gets lost or sometimes goes without doing because it's something that a lot of people just don't want to have a colonoscopy. So let's talk a little bit about what colon cancer is, what some of the symptoms are, so that we know what we have to be concerned about. So colon cancer symptoms. And before I give you the symptoms, let me say this. Just because you have one of these symptoms doesn't mean that you have colon cancer, but we do recommend that you definitely follow up with your primary care physician. If you're having any of these symptoms to make sure that you don't have colon cancer, especially if you haven't had your screening test. So symptoms of colon cancer include, not limited to, blood in your stool, having a change in your bowel habits, okay? If you're someone that normally has a bowel movement every day and all of a sudden you start having constipation that is persistent over a period of time, and you can't contribute it to something like if you don't drink water in a couple of days, yes, you're going to have constipation. But having a change in your bowel habits, having a change in your stool consistency. So in other words, if you normally have stool that's soft or normally have stool that's runny, that gets hard or different in color, then there would be a reason to be concerned. Other symptoms of colon cancer include abdominal pain, anemia, fatigue, as well as weight loss and constipation. So those are the symptoms. Those are not all the symptoms, but those are the main symptoms. So how do we treat colon cancer? So primarily, the treatment for colon cancer is removing the affected organ or removing the affected piece of the colon, if that's possible, and then having chemotherapy plus or minus radiation. All of that is decided, of course, by your primary care physician as well as the oncologist that will be seeing you in conjunction with your primary care physician, and as well as the team of people that will be seeing you if that's something that you have. So that's kind of how we treat it. So let's talk about when should we have a colonoscopy, right? So a lot of the guidelines for when you have a colonoscopy have changed in recent years. As a matter of fact, if you are 45 years old and have average risk, so if you're someone 45 years old with no family history and have average risk for colon cancer, we're going to recommend that at 45 years old, you have a colonoscopy. People that need screening earlier than 45 years old include this list of individuals. Number one, people that have family history of colon cancer or have family history of polyps. You may need a colonoscopy before the age of 45 years old. Check with your primary care physician as part of your annual exam and find out, hey, when do I need to have a colonoscopy? Secondly, personal history of colon cancer and polyps, of course, puts you at higher risk for having another case of colon cancer in the future. In addition to that, personal history of irritable bowel syndrome, ulcerative colitis, or Crohn's disease. So if you have ulcerative colitis or Crohn's disease, I'm sure that you're seeing a GI physician, and I'm sure that they've discussed with you the importance of you having your checkups on a regular basis. They probably have talked with you about how often you should have a colonoscopy, and they typically, especially if you're diagnosed obviously before the age of 45 years old, will have a regular screening colonoscopy. That is typically set up by your GI physician or specialist. So if you have family history of what we call Lynch syndrome, which is a hereditary familial adenopolyposis type syndrome, and that's a huge medical word that just means a family history of a certain kind of syndrome, of certain kind of polyps that occur in your colon. And polyps are growths or areas of inflammation in the colon that can sometimes affect how quickly you absorb water, nutrients, etc. From your colon. And then lastly, people that are at higher than average risk are people who've had any kind of radiation to your abdominal area. You're at a higher risk for colon cancer, and so we're going to want you to have that colonoscopy before you turn 45 years old, okay? All right, so that assesses, okay, when should we have it? So everyone should have one by the time they're 45 years old. If you have not had one yet, definitely contact your primary care physician and say, hey, I need to have that colonoscopy. We are aware that we're surging right now, so the pandemic. So a lot of people put off their primary care needs last year as a result of COVID because we all, were quarantined, didn't want to go anywhere. There are special measures that have been taken at this point by each GI office to make sure that your safety is ensured. So please do not go without this screening. Again, I want to just read those stats for you again. 12% of all the colon cancer cases in the United States happen. That's 18,000 cases a year from 2020 rather. That happened in the U.S. were in people that are less than 50 years old. That's the reason why we need a colonoscopy. So that person needs a scope. If you're 45 years of age or older, you need to have had a colonoscopy. So you might say, okay, Dr. Celeste, how often do we have a colonoscopy? Most people have one every 10 years. There are certain individuals, if they discover polyps in your colon, they may ask you to come back in 3 to 5 years. So you have to check with your GI physician, check with your primary care if they obviously would get a copy of your colonoscopy report so that you know how often that you need to go. And again, this is a disease process that disproportionately affects African Americans. And let's talk about some of the reasons why it affects the African American population more. It's directly tied to health disparities. There are greater obstacles for cancer prevention, treatment, and survival that exists in the African American community. This can be to a lack of health insurance, lack of a paying job, lack of so many different things. So a lot of the healthcare modalities and screening methods that some cultures get, some of that falls behind in the African American community due to different things that prevent them from getting the same level of care in terms of prevention, treatment, and survival that other places get, that other cultures get. I'm sorry. So we want to make sure that because we see that this is a disease process, 40%, and that's an astounding number. So 40%, African Americans are 40% more likely to die from colon cancer than any other ethnic group. That is a reason to make sure that you have a scope. We're seeing it in high numbers, especially in African American men. So we want to make sure that all the men that we love and care about have had their colonoscopy, in addition to the women, of course. But we as women sometimes do a little bit better job of taking care of ourselves health-wise than sometimes men do. So we want to make sure that we have that screening colonoscopy. So let's see if we have any questions. Let's see. I see Ms. Shorts is on. Hey, Ms. Shorts, thanks for joining us. If IBS makes you more at risk, it absolutely does. The reason is because you have an inflammatory process in your colon that can change or disturb the for lack of the floor or epithelium or the layers of your colon that are exposed. You can get a change there as a result of the irritation and inflammation from irritable bowel syndrome. So because it affects that layer of the colon, it can put you at higher risk for having colon cancer. So absolutely, you're right about that. Does anyone have any questions? Hey, Kim, thank you for joining us. Hi, Miss Simmons. Thank you for joining. Hi, Miss Jones. Thank you for joining us. And hi, Mr. Vason. Thank you for joining. And hi, Miss Jones, Monica Jones. Thank you for joining. If you guys have any questions, I'll be happy to answer those now. Don't let COVID-19 be a reason that you don't get your colonoscopy. Again, there are safe measures that are taken to make sure that you're protected when you get the screening colonoscopy. So some people have a question about, and I'll go into this a little bit in case someone wonders. So what happens when you have a colonoscopy? Like, what do they do? So when you get to the GI office, you have to take someone with you because they typically give you a little bit of a sedative to help relax you for the procedure, and you won't be able to drive afterwards. Most people don't experience a lot of pain after the procedure at all. You're actually, you're put to sleep or knocked out. So you won't feel anything per se. So there's no reason to be scared about having a colonoscopy for that reason. Does anyone have, Miss Jones is a colon cancer survivor. Let's celebrate you. That is awesome. That is awesome. So I'm sure that Miss Jones will attest to you how important it is for you to have that screening colonoscopy. It often is something that goes without being done. Let's see. Does anyone have any other questions? I hope that everyone is being safe and masking up when you leave your home. I hope that everyone is getting vaccinated if you're not already, as we are in dire straits in relation to that as well at this time. Does anyone have any other questions? Any questions? I just want to remind you guys that if you're experiencing sick symptoms right now, especially, fall, we're getting ready to go into fall, that weird winter time, that weird weather time rather. Here in the state of Alabama, we know what happens. We know the ragweed is coming. We know that it's coming. We know that it's going to irritate your sinuses and the like. So because we know that, we want to make sure that we keep our maintenance allergy meds on board at this point. If you are having nasal congestion, especially with the Delta variant, a lot of the symptoms for some people are very much nasally and loves to hide right back here in the back of your nose. So we want to make sure that we take our maintenance meds. If you're having nasal congestion, sore throat, any of those symptoms, please get tested and please refrain from being around other individuals, whether vaccinated or not, so that we know if you are positive or not and if you should avoid and do those things that we know to help protect one another. Let's see. All right. Thank you, Ms. Short. She said vaccinated and masked up. I know that's right. Vaccinated and masked up. Okay. Stay safe, everyone. Anyone have any other questions? She said she had all the symptoms that you named. So this is one thing that we'll see a lot of the times in clinic is that, patients will present saying, I have this blood in my stool. I'm having this. If you have blood in your stool, let me say this. Please don't ignore blood in your stool. Do not ignore blood in your stool. Call your physician. Find out if you need to be seen. If you know that you have a hemorrhoid and you get blood in your stool, we know that that's something that can be a normal process for that particular disease. But I'm saying that if you're getting blood in your stool and it's unusual, any kind of difference in bowel habits, something that's very unusual for your system, and keep in mind, you're with yourself every day, so you know how often, and this may sound gross to some, this is not going to gross me out, but you know how often you have a bowel movement. You know if the stool that's coming out is consistent with what it normally is. If it's different and it stays different, sometimes your stool can be altered just a little bit based on what you eat. If you eat a lot of hot wings or a lot of hot sauce or a lot of different things, that can change your stool's appearance. But if you consistently see, I see a little blood in my stool, and let's say you go a day or so and you don't see any, but let's say you see some a few days later or a week later, I'm seeing some more blood in my stool. And a couple of days later, you need to see your physician and find out, okay, is this normal? Is something going on? Is this something I need to be concerned about? And again, I want to stress that this is something that's really affecting African-American males. A lot of times our men will not go in to the physician to be checked and have regular screening tests done. And this is something that we, as a people that love them, should do. So especially if you're someone that has had a colonoscopy already or has had an experience that you can share with them. Chadwick Boseman was only 43 years old when he passed. And think about how much he gave us, right? And then think about the fact that his last movie that he produced, or that he was a part of, happened while he was fighting colon cancer, which is amazing just to be that kind of role model for us. But he was only 43, right? So the age that they currently recommend that you have a colonoscopy is 45 years old. He's African American, he's male, so we know that there are higher risk in that population and in that group in particular. But he had it and it killed him, and he only made it to 43. So that's all the more reason to make sure that you're having your regular primary care visits with your regular doctor. At your primary care visit, your physician is going to talk to you about your family history. I cannot tell you how important it is to review and know your family history and make sure that you've talked to your relatives, your mom, your dad, your aunts, your uncles, your grandparents, to find out what disease processes run in your family, because prevention is very key. A lot of times, there's treatment available for colorectal cancer, and one of the things that creates survivors of it is that you get to it sooner. So we're just trying to get to it sooner so that we can treat it. If you have to have surgery, chemo, radiation, etc., treat it so that you can actually have the rest of your life to live. So that's the reason for our broadcast, or the topic for today's Let's Chat. Does anyone have any other questions? Any other questions? Okay. So that's all we had to share with you guys today. I hope everyone has a great rest of your Sunday. Those of you that are in Alabama or New Orleans or Mississippi along those coastlines, please be aware that there is a hurricane that's coming our way, and take the necessary precautions. That's all we had to share. So I hope that was helpful for you guys. If you're interested or in need of COVID vaccines at all, we are continuing to vaccinate our office 5 days a week. In addition to that, we are offering COVID testing for those patients that need it. You can make an appointment on our website at drcelestec19.com. It's drcelestec19.com. Forgot to spell the name. So that's where you can go and get a vaccine appointment or an appointment for COVID testing. Okay, and so, Miss Daniels, she's a colon cancer survivor. Yay, Miss Daniels. Congratulations. We celebrate you. So you see, so these ladies that are on now are cancer survivors. So they got to it in enough time that they're with us to testify about it today. And so that's encouragement, and all the more reason, if this information has been helpful for you, please share it with your family and friends, especially the men that are in our lives who may not pay attention to their health as much. All right. You're welcome, Ms. Daniels. You're welcome. And you're welcome, Ms. Shorts. I hope that you guys have a wonderful day. Again, if you're in need of testing or vaccines, you can reach us at 205-291-8842 or visit our website. That's the quickest way to get an appointment at drcelestec19.com. Thanks so much. Have a good day. Bye-bye. Happy Sunday.